For many decades, visceral leishmaniasis, also known as Kala-azar, cast a long, deadly shadow over South Asia. It spread silently through the bite of a tiny female sandfly, turning an invisible sting into a battle for life itself. Tens of thousands fell ill every year. The poorest and most vulnerable were hardest hit.
Every year, from 15,000 to 90,000 cases of visceral leishmaniasis or Kala-azar were reported. During that time, Bangladesh, India, and Nepal had 80% of the Kala-azar of the world.
In 2005, Bangladesh, India, and Nepal signed a historic memorandum of understanding. They also developed the regional strategy for Kala-azar elimination in South Asia.
Over the last 20 years, a remarkable transformation has unfolded.
So those who have seen the poverty in Bihar or Jharkhand, they would know that how poor these patients are. I think WHO and the government of India and including academia has done a great job in reversing this trend and bringing down this disease from a mountainous height of say several 100,000 patients to 300 patients in 2024.
So Bangladesh, we also started the elimination program to alleviate the poverty through addressing these dreadful diseases, along with purchasing of diagnostic medicines and also insecticides for controlling the vector.
Nepal reduced Kala-azar cases by more than 90% in the period of 2005 to 2015. To sustaining our achievement on Kala-azar elimination process, we have strengthened our surveillance system and 3-year follow-up cases by increasing regular financing from government and partners, enhancing entomological capacity in the high-risk areas, and also enhancing cross-border collaboration.
The journey against Kala-azar has been defined by scientific breakthroughs, the creation of rapid, field-friendly diagnostics, simpler and more effective treatments, and stronger vector control strategies.
I think this is one of the very rare examples where academia has provided tools for elimination of a disease like Kala-azar in Indian subcontinent.
Backed by WHO TDR and DNDi, scientists across the region introduced breakthrough tools that changed the course of this fight. Miltefosine, the first oral drug for Kala-azar, simple, effective, and accessible. Ambisome, a single-dose, short-course treatment that proved life-saving. And the RK39 rapid test, fast, field-friendly, and revolutionary, bringing diagnosis to the doorstep of every village. Together, they turned the tide against a disease once thought unstoppable.
Integrating the innovations for diagnosis and treatment as a point-of-care test and treatments within the primary health care was critically important to accelerate the program and also to sustain the program as we went along.
WHO, TDR, and WHO itself provided so much support in elimination of Kala-azar in Bangladesh. Along with that, other development partners like UK and Melinda Gates Foundation and DNDi, JICA, they also provided support in achieving our elimination.
After decades of determination, South Asia stands at the threshold of a remarkable public health achievement. In 2023, Bangladesh became the first country in the world to eliminate Kala-azar as a public health problem. India and Nepal are now at the cusp of achieving the same milestone. To ensure this progress continues, countries are already planning ahead. Post-Kala-azar dermal leishmaniasis, or PKDL, can appear after recovery and silently spread the parasite, threatening elimination. Tackling it is key to sustaining progress achieved.
Today, the concept of multi-disease elimination builds on these factors which we have used for Kala-azar elimination, where we have a patient-centered approach to the primary health care, and we also break down the silos and also address the social determinants to health.
Southeast Asia's journey against Kala-azar is a story of political commitment, regional collaboration, and community engagement. It shows that when leadership, communities, and science come together, elimination is possible, even in the toughest settings. In this journey, our region has created a blueprint for people-centered, multi-disease elimination that can inspire the world.